Hello, everyone, and welcome to Overtime. My name is Nick Souter. Thank you very much for joining us. It's the beginning, I think, of the period we were expecting. A month ago, we spoke a lot about this. We've managed to take a bit of a break, and I think we're going to have to start to ramp up again. Certainly, a lot's been going on, and there is a super chat, Jackalope Herdmaster. Herdmaster, $5. Keep up the good work. Thank you very much. We sincerely appreciate it and the support of everyone who super chats, our patrons, everyone who becomes a member. It means a lot to us. Everybody here works very hard to try to get as much information to you as accurately as possible and as quickly as possible. We have a lot to cover today. I'll start with Bubba Wallace, who is a driver in NASCAR, and one of his crew found what appeared to be a noose in the garage. He checked the other stalls. It was stall 43 on Sunday, and he checked the other stalls, didn't find anything like it. They had tackles that can sometimes look like that, but he reached the conclusion that that's not what that was in this case. Obviously, a noose in the middle of what's been happening with the Black Lives Matter, Mr. Wallace having African American descent. It was taken very seriously. The president of NASCAR, Steve Phelps, called him in what Bubba Wallace described as, quote, a phone call I'll never forget. Phelps even went to his house and had a in-person conversation with him and described this as a hate crime. On Wednesday, he spoke with him again and said that he was going to find who had done this and kick him out on the spot. The FBI has been investigating and has reported that everybody in both the NASCAR and in the all of the drivers have been cooperating with the investigation. In a sign of solidarity and support, the drivers, pit crew, and everybody working on the track at NASCAR pushed Mr. Wallace's car to its position before they were preparing for the, which was it? It was the, I've forgotten the race. Geico 500. Who could forget Geico? My bad. But this is them pushing the car. Theory prohibited from showing it whenever we show something like that with the audio on. Usually, the at least at a minimum, that particular episode gets demonetized. But what we're going to do is we are going to put the audio on and we will show it. So give me 1 second to turn that audio on. I was going to leave it off because there are some copyright concerns, but I think you're right. I think it's worth the audio. Obviously, this is not our audio. We do not own this. Probably going to be, I believe it was Fox Sports. So let us activate the sound on this. Please give me 1 second, and I think it is worth it. All right, so the sound is now on. Please let me know if you have any difficulty hearing this again. Once again, this is Bubba Wallace, his car being escorted and pushed to its position for the Geico 500.
All of NASCAR's drivers have rallied around Bubba Wallace, the NASCAR Cup Series lone black driver. After what happened here yesterday after.
That was video of the escort of Bubba Wallace to his position for the Geico 500. The FBI has reached a preliminary conclusion that it was actually not a noose, that the it was according to them, they believe at this point, it had actually been put there several months in advance and had only recently been discovered. Let's see, I'm going to try to find, and they mentioned there Richard Petty. Richard Petty was there. It was the first time he's actually attended since the start of the COVID-19 pandemic. He has been avoiding all the races, but he was there for the walkout. Wallace initially rejected the findings of the FBI and said that it was a straight up noose and that he was frustrated by people who believed that this was simply some case of misidentification of equipment, but has since then come out and said on Twitter, quote, "It's been an emotional few days. First off, I want to say how relieved I am that the investigation revealed that it wasn't what we feared it was. I want to thank my team, NASCAR, and the FBI for acting swiftly and acting as this were a real threat. I think we'd gladly take a little embarrassment over what the alternatives could have been. Make no mistake, though some will try, this should not detract from the show of unity we had on Monday and the progress we've made as a sport and to be a more welcoming environment for all." It's difficult to show that. I think you get mixed feelings at a time like this. You're glad that it was a hoax, but it's so rare to see that kind of unity, and it's a beautiful thing. It's been said, and we discussed this I think a couple streams back, that it's an interesting time, and there are people who are saying that for the first time there's a feeling that there might be some real change because people have really had enough and have there seems to be a agreement of all people, all races and colors in the United States that it's really been about enough of this. Now, you're not going to end racism anytime soon. This isn't going to end things, but it's usually 2 steps forward, 1 step back. And it would be nice if we took our 2 steps forward. We've been a little overdue, I think, for that. The election of Obama was certainly 2 steps forward, and Trump has taken Obama's work so personally that he's been undoing it. I don't. There's a lot of people who think it's racism. Certainly, having white nationalists in your senior level advisory positions when you start out as president doesn't help with that image. I don't think it's that. I think it's insecurity. He may also be, I don't know. I can't opine on that, but a huge level of insecurity that has caused him to undo a great deal of work. I'm hoping we're going to take our 2 steps forward on this reasonably soon. At any rate, Kentucky has seen some difficulties regarding their elections. They decided to limit their polling places by over 95% from former 3,700 polling locations in a typical location to, at least according to the Secretary of State, 170. That's from 3,700 to 170. Lines at the polls were reported to be blocks and blocks and blocks. Everybody's polling place was, of course, changed. Their chances were excellent that your former polling place was now closed. There's been some contesting of the results, saying that people were denied their ability to vote. We've had discussions like this with Landon. Unfortunately, probably won't get anywhere. That may be its own show that we'll discuss at some point, but it does appear to be a staggering abuse to limit that kind of polling to that extent. There was a court challenge to hold the polls open later. Doors were closed. There were reports of people banging on glass and almost breaking into the polls trying to get in. The courts did insist that the polls stay open a whole half hour later to accommodate people who had still been on the curb to the most immediate block to come in, and ended at that. I think that's going to be its own future show. But for now, I think the big story is COVID. Both Dr. Fauci and Dr. Robert Redfield, director of the U.S. Centers for Disease Control and Prevention, have been asked about President Trump's assertion that he had told staff to slow down testing because it was making him look bad. They have said that testing is increasing, not decreasing. I'm inclined to believe this. I do think he was being tongue-in-cheek when he said that. I think it takes a lot of cojones to be tongue-in-cheek about something that's killing so many people. But I don't think he cares about testing one way or another. I think he probably would slow it down if he could, just because A, it's a pain in the neck, and B, it costs money, which he doesn't want to spend. And he is going to slow it down, actually. Right now, there have been no instructions to slow it down, but the Trump administration is ending funding and support for local COVID-19 testing sites across the country, including in many states where hospitalizations are rocketing. We are going to discuss Dallas briefly. In Dallas County, Texas, the federal government will end support on June 30th for 2 emergency testing sites that it has been supporting since March. Rocky Vaz, the director of emergency management in Texas, has confirmed that these sites will be closing and has asked that they stay open. The federal government will not do that, and those sites will close. He has said that the reason the numbers are so high is because, and this he did not say tongue-in-cheek, this he was serious about. The reason the numbers are so high in the United States is because we're doing so much testing. One, we are doing less testing than almost any other industrialized nation, and we haven't been increasing testing at the exponential rate growth of COVID. Our testing is very low, and it's going down. And if it's really the testing, that's fine. But then he needs to explain why COVID patients in Texas hospitals have now risen by 63% in 1 week. 63% increase in the number of COVID patients in Texas hospitals in the period of 1 week. The number of COVID patients in Texas hospitals is up 171% since Memorial Day. The number of confirmed COVID patients in hospitals went up 361 in 1 day to 4,092. This is the 12th straight day of record-setting new COVID cases. They have now confirmed 5,489 new cases, which shatters their previous record of 4,400. They have gone up by 1,000 new cases in, I don't have that there. I believe that's 1 day. That's the increase 5,489 to from 4,430 to 5,480. The Texas governor, and I apologize, I'm going to get the live chat back. The Texas governor is urging people to stay at home and has said that there is in fact a surge of COVID cases, and there are now health officials in Texas calling for stricter measures, which has been interpreted to mean a possible lockdown, which Texas has ardently avoided. The culture of freedom and, we do what we want has caused them to resist it. Things have to be pretty bad if they're talking about an actual lockdown in Texas, which if they'd done the first time, might not be where they are today. Because the spread is so rampant right now, there is never a reason for you to have to leave your home, said Governor Greg Abbott. Unless you do need to go out, the safest place for you is at your home. The new cases are rising in a rate that Abbott calls unacceptable, with Texas reporting more than 5,000 cases in a single day. Yeah, sorry, that wasn't the total cases. That was the. That's right. My bad. So they went. Their previous record was 4,430 new cases reported in a day. That's 4.4 thousand cases in a new day. That was their previous record 2 days ago. Yesterday, that record went up to 5.4 thousand new cases. This is the exponential growth we've been talking about. this is what happens. California has obliterated its previous single-day high with more than 7.1 thousand new cases. Their previous, set 2 days ago, was 5,000. So they've gone from 5,000 new cases to 7,000 new cases per day. Current projections are now between 180,000 to just under 250,000 Americans dead by October 1st. Once again, 180,000 to 250,000 Americans dead by October 1st. The 180,000 is the White House projection, which has been historically phenomenally wrong and on the low side. It's right oftentimes because they end up adjusting it repeatedly. It just keeps going up, 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 up until the day before when they're kind of close to right. Their projection is 180,000. Columbia University has about 250,000 Americans dead by October 1st of COVID. It's hard to tell these numbers because because unfortunately it's difficult to predict with social distancing. Right now, it appears a large number of Americans are not wearing their masks, and the CDC has said unless we get up to 95% of Americans wearing masks, they do not foresee any significant decrease in those projections. What we'd like to show you now, this is New York. Actually, it's New York, New Jersey, and Connecticut. What you can see here is the spike where New York entered a state of triage. We discussed triage. We're going to be discussing it again in a minute. What they did was a complete and total lockdown, and you can see they've gotten control of those numbers. How long they're going to remain in control is a point of contention. But it worked. It worked. This is where Texas and Florida could and would be if they had done, and I'm beating a dead horse. I'm aware of that, and I apologize. But this is science. We know what's going to happen. And we said 2 or 3 weeks ago, we're going to take a break. We didn't get much of a break because there have been riots, but we're going to take a break. And when the numbers start to go back up and when it gets really bad again, we're going to cover it again, which is why we are here. We have now seen that New York, New Jersey, and Connecticut, all the states that have managed to get this reasonably under control, are now issuing quarantines against travelers from Alabama, Arkansas, Arizona, Florida, North Carolina, South Carolina, Texas, and Utah. If you go to New York, New Jersey, or Connecticut, and you're from any of those states, you will be in a 2-week quarantine. You will not be permitted to go anywhere throughout the state. Why? Because those states don't have it under control, and at the present moment, New York appears to. I keep saying appears to because, unfortunately, they have released many of the restrictions, and there are more cases. It's a 2-week lag period. We've discussed this many times as well. 2 weeks between when you take an action and you see the effect of it. The example I often give, a little nerdy, I know, but the sun. The sun is 8 light minutes away. What you see now when you look at the sun isn't the sun as it is right now. It's as the sun was 8 minutes ago. That's because it takes the light 8 minutes to get from that star to our planet. If the sun exploded right now, we wouldn't know for 8 minutes. We'd look at it and still see it there. It ain't there anymore, but we'd still see it there. There's an 8-minute delay between anything that happens on the sun and us being able to see it or be affected by it here. Nothing can change that. Nothing can change that. Speed of light, it's a constant. In that same way, there is a 2-week delay between anything that happens in regards to COVID, positive or negative, anything that happens, and our ability to detect that. If the entire country goes on lockdown, the numbers will still go up as if we were all hugging and kissing and having a good time with each other out in public. And they'll keep going up for 2 weeks. We are today suffering the consequences of what we were doing 2 weeks ago. Nothing can change that. That has to do with incubation period. That has to do with there's a great deal. It's basically incubation. But long story short, what we're seeing now is where the virus was 2 weeks ago. Where it is today is far worse. These numbers in Texas will continue to rise. Nothing can stop it. The infections are already out there. We just can't detect them yet. But it will. If Texas locks down right now, at this very moment, the infection rates will continue to rise at the exponential rate. It used to be every 3 days. Now it's, I think, in some cases, they pushed it back to every 3 weeks as a result of the social distance. It doesn't matter. Whatever the rate is, the new rate is going to be, we have to do the math again because people are actually practicing some social distancing. So that is helping. It's what's called flattening the curve. It's slowing the rate. But the rates are still going up astronomically high. That's what it's going to do. And if we shut everything down right now, they'd still go up for 2 weeks as if we hadn't done anything, because that's the difference between when an action happens and when we see it. Not with all diseases. Wouldn't be that way with Ebola. This is one thing I did want to, well, I'll discuss that in a second. Not that way with each disease is a different rate. For this one, it's about 2 weeks. So these states that have opened and said, see, we've been open for a week, 9 days, no problem. The numbers are going down. That's because you're still seeing the effects of the closure. So I think it's an odd experience, and I hope some of you will come to our Discord and talk about it. We've been talking about it on the Discord. We also have current news is always being dropped on the Discord. It's a little odd to be seeing a train wreck before it happens, and you can tell people that it's coming, and there isn't much you can do. We predicted roughly to within the day when we'd have to start broadcasting on this again, and it's about now, based on the Florida and Texas openings and what's been going on in California. The other bad news about this is this probably isn't the one. There's good news in that, but this probably isn't the one. But I guess, there's the one, the earthquake, the 10.0 that's supposed to hit California, and half of California is going to sink into the ocean. That's projected to happen sometimes in the next 50 years. It's been projected to happen sometime in the next 50 years for the last 30. I don't know how the math works on that, but nonetheless, presumably it's still sometime in the next 50 years. If it continues to be that next 50 years for the next 30 years, I think you're going to be okay in California. There was an earthquake, 6.1 in California earlier today. Every time there's an earthquake, people say, is this the one? Is this the one? No, half of California is still there, so it's not the one. We've been expecting a global pandemic that would decimate the human population on this planet for quite some time. Something along the lines of the Black Plague. There are a lot of things that cause it. The fact is our cities are getting large, our populations are getting more and more dense, so you're going to see something like this. A lot of people are thinking that COVID is it. Not quite virulent enough, or deadly enough. Just not. This isn't the worst case scenario. We're still expecting the worst case scenario. The good news is now we're practicing. Now hopefully we're going to take it seriously, and maybe when the worst case scenario hits, we won't be hit as hard. I will say that Ebola, it's not going to be Ebola. People think it's going to be Ebola. Ebola is a brutal disease. It has one of the highest mortality rates. It's not 100%. The only 100% mortality rate disease that I'm aware of is rabies. I think there's one other 100% mortality rate. If you get it untreated, you're dead. Period. Rabies is one of the few 100% mortality rates. Ebola doesn't have a 100% mortality rate. It's about 90%. But the problem is it's too lethal. It kills too quickly. The symptoms can be detected very, very rapidly. So if you have Ebola and you get on an international flight, by the time you land, people will know something's wrong with you. People will know something's wrong with you, and they're not going to let you off the plane. The reason this transmits so much and so hard to stop is because you can be infectious, you can give it to other people and show no symptoms of it for up to 2 weeks. That's a problem. Now imagine something that's as deadly as Ebola, but has that kind of incubation period. That's the nightmare scenario. At any rate, we saw California do this well in the beginning. They seem to have stumbled a bit. New York has done this well so far. I think they've probably stumbled a bit, but we're not going to know for 2 weeks. So this is going to require some following. The other thing that's worth noting, and I suppose I would like to try to keep politics out of this. It's largely unavoidable. There's an interesting phenomenon, and we talked about science communication, and this is one of those that if you don't understand how it works, it's going to sound awfully strange. Diseases tend to hit liberals before they hit Republicans. Or conservatives, I should say. Republicans haven't always been conservative. Republicans were actually liberal about 80 years ago. But nonetheless, liberals tend to get hit by diseases first, tend to get hit by them very hard. Conservatives get hit with them later. Just happens. It happens since the dawn of time. Why? Well, as it turns out, people tend to be more liberal in highly populated areas. The reason for this is because you're coming into contact with a wider variety of people. You get a wider variety of new ideas. It's harder. It's still possible, but it is harder to be racist, homophobic, transphobic in a large city where you're going to encounter these people all the time, where you're going to have to rely on them just as they have to rely on you, where you have a taxi cab driver, where you have a coworker, where you have people who are that different. Cities tend to be far more liberal. They also tend to get hit much harder by these kinds of infections early on. That's why the coasts got hit first. That's why you have areas with airports. The big cities get hit first. That's the coasts. And when this happened, you saw a lot of conservative states saying, well, we're not going to get hit. Yep. And just as hard. Just as hard. It's just going to take longer because the population density isn't as high. But believe it or not, it turns out that the mortality rate and the transmission rate is identical for Republicans and for conservatives as it is for liberals. It kills just as many of them. It just takes longer because they tend to be more rural. That's all. It will happen. And I asked a question about a month ago. I said, what's going to happen to Donald Trump's policies as he sits here and says, well, we're going to let the states take care of it and we're not going to help. The federal government isn't going to release its emergency stockpiles. The states are on their own. When most of the states and the cities being hit were cities like Los Angeles, New York, Boston. What happens when it's Dallas, Texas that's hit? What happens when Dallas, Texas hits a state of triage? Triage, most of you probably know what that is. Very quick. Triage is an emergency condition, usually in hospitals, where they follow a very strict set of rules as to who they will treat and who they will not. You enter a state of triage when the demand for medical resources usually far outstrips that what you have. If you have 200 hospital beds and 1,000 sick patients, you are in a state of triage. You have to figure out which ones get the hospital beds, and you have to do it quickly because every time you spend even 5 seconds trying to make up a decision, people are dying. Triage is nothing more than a set of rules. This is how you determine who gets a bed. One of the ones, and we had this discussion with John Peterson, who's a friend of the show and called in and was upset because his father, actually I think it's his father-in-law, was 80 years old, over 80. And according to the rules of triage, if he got sick and went to the hospital, he would not be treated. He would not be treated. Period. Great guy. Wonderful guy. Probably some real evil people that they are treating. But if you're 80 and you're sick enough that you have to go to the hospital, there's over a 50% chance you're not coming out alive if you have COVID. Over 50%. If you're 50 years old, you have about a 30% chance of 30% mortality rate. You have a 70% chance of surviving. 70% chance of surviving versus 50. So they say, we're not even going to bother with the 80-year-olds. We're not going to bother. Sounds brutal, sounds terrible. Welcome to triage. Italy was in a state of the worst triage that we've seen in a modern city that I can think of in modern history. New York came very close to that and was in a similar. If you needed dialysis, you're not going to get it in New York during the height of this. You weren't going to get it, and people were dying of renal failure. Regular diseases that could be treated, people couldn't treat in New York anymore because they were too busy in triage, just saving whoever they could from the COVID disaster. Texas now has one hospital that has dedicated itself to COVID patients. If you show up there and you've got anything, you've got a gunshot wound, they're moving you to another hospital. This one's treating only COVID patients. That's how bad, and it's going to get worse. They saw 1,000 new cases, almost a 25% increase in new cases in one day. This is the confluence of the math that we've been talking about, the math that of the exponential increase, and what we're going to see. My prediction is that now that his base is suddenly getting sick, you're going to see him start to take this seriously. And for people who've said he's been taking this seriously all along, usually it's his base who hasn't been getting all that sick that's saying that. Once they start getting sick, let's see how seriously he's taking it. But New York has been on its own. Texas is for now. He is, in fact, pulling the funding for Texas. Let's see where they are in 2 weeks. This is the beginning. Texas is on the verge of their medical system is now at capacity. Think about this. They had 20% new cases in one day, and their medical system is currently at capacity. So is Florida. And again, because there's a 2-week lag, there's nothing they can do to stop these new cases from coming in. So my suspicion is we will be seeing Dallas in a state of triage similar to New York within a 2-week period. They're going to be overwhelmed at this rate. Again, it's hard to predict. These are new numbers because of the social distancing. The speed has changed. The lethality of it hasn't, but the speed has. My guess is actually probably within 5 to 9 days. I'm guessing Texas is going to enter a state of triage, formally enter a state of triage for most of the state. Florida will be roughly around that period of time. These are American cities. Wealthiest country in the world. And we saw it coming. I don't think that's either here nor there right now. I think the biggest concern is what are we going to do? We will continue to try to keep people as up to date and informed on this as possible. I apologize. I've been staying out of the live chat. I've been just trying to keep things running smoothly on the back end. But thank you all for joining us. I'm sorry that there isn't any better news, but those of you who've been fans of the show for a while, and again, we really do appreciate your support. You know this has been coming, and we've been talking about this. So we will continue to do reasonably regular updates. I don't think we need to do daily updates yet. We may. We were doing daily updates when it was that bad in Italy, and we were doing daily updates when it was that bad in New York. So we're going to see where we are, but I think we're going to keep an eye on it, and as needed, we will keep you all in the loop. But until then, I would like to thank you all for joining us. Ethan is unavailable right now, but we look forward to seeing you guys on our next regularly scheduled show for next week. And I apologize, sorry, I was distracted there. Look forward to seeing you both on In Time and on our next Overtime, which I have a sneaking suspicion is going to be probably in the next couple of days, because there's always something. Good night, everyone.